Hello everyone, this is the introduction video for PHA 120 inventory maintenance. So again, this is a 2-week course. So we will have this week and next week to kind of cram everything in. Most of this is supposed to be kind of a hands-on thing, so I'm kind of adjusting some of the labs for you guys to be able to complete and do via online, but we still will have to come back and do a lot of the hands-on portion to move forward and get this class completed. So where I wanted to kind of start with this for this day is, so inventory maintenance is one of the most important aspects of pharmacy, not only from a financial standpoint, but also a safety standpoint. So it is all of the pharmacy staff's responsibility to make sure that we are practicing proper policies and procedures when it comes to any sort of drug inventory, supply inventory, and things like that. Joint Commission is an accrediting body that most healthcare facilities, especially if they accept Medicare and Medicaid patients, are required to have accreditation through. And Joint Commission comes in and they do inspections every 5 years, typically of facilities, to see that these facilities are following proper policies and procedures for many aspects of both patient safety and quality of care for our patients. So in terms of a pharmacy and getting that type of inspection, what they're looking for is making sure that we are practicing proper inventory maintenance policies and procedures to ensure that we're not dispensing expired drugs, to make sure that we're not dispensing any recalled medications. So we are bound not only by federal law, state law, but also accrediting bodies to ensure that we're practicing all of the proper techniques and inventory maintenance procedures to make sure that we are not going to put the patient in harm in any way. So there's only 2 entities that can issue drug recalls. I'm going to kind of step up here to my board here. So drug recall classifications, if you look at your sheet, there's class 1, 2, and 3. And if you read through that, it will tell you each one specifically, and we'll go through that as well. But there are only 2 entities that can issue drug recalls. The FDA is the first one, and the other one is the drug manufacturer. And typically when you have a drug recall issued from the drug manufacturer, it's on a voluntary basis. Once the FDA gets involved, that is not a voluntary basis. They are telling you that it needs to be pulled from the shelf for whatever reason, and it must be done. Same thing here, when a drug manufacturer voluntarily issues a drug recall. It could be something simple as there was a shard of plastic that got into a specific lot number, and they don't want patients to accidentally take the plastic instead of the tablet or the capsule, so they're issuing a voluntary recall. So what does that mean for pharmacy technicians? Pharmacy technicians are typically the ones who are given the drug recall sheet, and we are searching the shelves. We are searching our Pyxis machines up on the hospital floors in both retail and hospital settings. So retail, we're searching the shelves. We're going back and making sure any patients that may have been dispensed this particular lot number and expiration for this drug are notified, and we get all of that drug back. So what happens when we get the drug back? One of 2 things. The drug manufacturer will let us know what they want us to do. A lot of times they'll have us package it all up and send it back. We get a credit for it. A lot of times they'll say just count the total quantity that you have, submit a claim form, we'll reimburse you, and the pharmacy is left to destroy it on their own. So again, the only 2 entities that can issue drug recalls are the FDA and the drug manufacturers themselves. So a drug recall, is the most effective way to protect the public for any device manufacturing issues or product like pharmaceuticals, drugs, medications. It's the best way to protect the public from any defective or potentially harmful products that may have been out there, or may have all of a sudden, a specific patient group that has, diabetes or some other underlying health condition, it's starting to cause fatalities or things like that. So a recall is a voluntary action taken by a company at any time to remove a defective drug from the market. So again, from a drug manufacturer's aspect or point of view, that is a voluntary thing. When the FDA comes in and says you got to recall it, they don't have much choice there. So your homework assignment, if you look in your chapter, and we're just going to cover that here real quick, there's a link. So the homework assignment that is not due until Friday, there's a link to the FDA drug recall section, and if you search down, or if you scroll down, you will find a list, and it goes on for many pages, and it breaks it down by the date that the recall was issued, the drug name, the product description, the reason for the drug recall, and then the company name. You have to physically click on the drug name or brand name as it's listed to search there for the other information I've asked you. I've asked you for what the specific lot number, expiration, and NDC number of the product are. So make sure you complete that. Drugs and drug safety is strictly monitored by the FDA, or the Food and Drug Administration, in the U.S. before going to market, but they still are monitoring these things even after a drug has been approved for public use. So the drug recalls, there are 3 classifications, okay? So we're going to go over that. So a class 1, I should write class 1, not C1. Sorry about that. So a class 1 is the most severe. So there's reasonable or high probability that taking or using the drug will cause serious adverse health consequences and even death. So okay, class 2 is kind of the next step down. And in this, they've determined that use of the drug may cause temporary or medically reversible adverse health consequences. The probability of serious health adverse consequences is remote. So what they're saying here in a class 1, most severe, this is where the serious health consequences and even death occur, and these are not reversible. Here, these are able to be medically treated or reversed. Okay, so a patient has taken something and they've had a severe adverse reaction to it, but we were able to administer other medications or other means of medical intervention to reverse those out, and that's why it didn't cause death, didn't cause permanent disability, those type of things. That's a class 3, or class 2, excuse me. So class 3, okay, this is the one that most drug recalls fall under. So this one is using the drug is not likely to cause any adverse health consequences. So So under a class 3, this is where things that typically the voluntary drug recalls happen. So for example, they notice that on their manufacturing line, somehow, extra powder or extra shards of plastic or things like that got into the bottle. They're going to recall that out. That's not going to cause serious or any adverse health effects because they're taking the tablets and not the shards of plastic and stuff like that. Another thing is maybe the labels were wrong. Maybe they got put upside down. Maybe they got put on incorrectly. Those type of things. Those would warrant a class 3 recall on that situation. So again, the most important factors to remember is that there's 3 levels of classes for drug recalls, and that only 2 entities will be issuing those drug recalls. So when, again, as pharmacy technicians, that's going to be our role. We're going to be looking out for those. Those recalls are communicated by the FDA specifically, or if it is a manufacturing drug recall, those recalls are going to come from directly to our pharmacies from either our wholesaler, who we purchase our drugs from, or the manufacturer itself. Typically, it's the wholesaler. Pharmacies use wholesalers to get good deals on drugs. It's kind of a centralized warehouse where we're able to order kind of everything through. And those wholesalers will communicate to us. They'll send us electronically. They'll also put it into our daily orders of, hey, this is the drug recalls. And then usually 1 or 2 technicians are assigned that duty to go in and pull those off of the shelf. Now, last piece, okay? When you're determining, well, I have this drug, but how do I know it's part of the drug recall? Okay? So on a drug recall, you're going to have the drug name, the strength, the route of administration, which means is it a tablet, capsule, cream, injection, etc. And then it's going to have a specific lot number. It's going to have an expiration date. And it will have an NDC number. So the thing about the drug, okay, when a drug manufacturer creates a drug or brings a new drug to the market, each manufacturer assigns that particular drug an NDC number. Now the NDC number is the same number that's used even if it was first patented and delivered in 1980. That NDC number is going to be exactly the same now in 2020. So yes, we use this as an identifying marker, but that doesn't particularly mean that the drug bottle on the shelf that you have is what's being recalled. The 2 identifying markers to that are here, because this identifies the batch. So you are going to look, the drug name matches the strength, the route of administration, whether it's a tablet, capsule, cream, whatever. The NDC matches, but then these 2 here identify the batch that it came from. If the lot number and the expiration date on your bottle, on your shelf, matches the recall, you are to remove them. If the lot number and expiration date are different and they are not listed on the drug recall, they are not part of the drug recall. They are safe and you can leave those on your shelf. Okay? So again, sorry, I'm trying to adjust here, and I know there's a little bit of some lighting issues here that I'm trying to work the kinks out on that. Okay? So again, This is just covering the drug recalls. Drug recalls is one of the most important pieces of our inventory maintenance. This should help you be able to complete your homework assignment. We're going to continue talking about this as we start to head into chapter 7 and 9 for this course, but this is kind of a video to get you a head start on everything. As always, if you have questions, please email me. The links for the assignment are attached to the homework assignment itself and also on the folder announcement, so you can access those as well. And I hope everyone has a good rest of the day. See you tomorrow.